Hi, and welcome to the Aging is Cool Safety Essentials Training. This is information to help you when you're out providing classes and supports to residents or seniors in whatever setting we might be in. These are some common scenarios that come up and some issues that we just want you to be very aware of. Please always remember that safety isn't just about protecting the residents, it's about protecting yourself and protecting Aging is Cool as a company. First thing always to keep frame of mind is that instructors are not caregivers. We are there to interact, to engage, to entertain, to host a class, but we are not there to provide hands-on assistance or any assistance with people's daily lives outside of that particular thing. We are there for classes, not care plans. So be very careful about the types of support that you're providing. And we'll talk a bit more about what those might look like. So a few things to be very aware of when we're working with older adults. First of all, older adults are at a higher risk of falling, overheating, and illness. And this is so integral and important, particularly as our fitness classes can exacerbate heart rate, cause opportunities to fall and to trip. We have aquafit classes that run in very hot months in very hot states. So, Vegas, Phoenix, Austin, Florida, these are some of the hottest places in the country, and we are doing outdoor activities there. The instructors are the leaders in the room, and so the residents are going to follow what you're doing. You are there to demonstrate what good safety looks like. Prevention is always easier than response. If you prepare and you look at your environments and you look at the program that you're about to offer and make sure that falls are prevented, the room is cool enough, there's plenty of water, you are going to have it a lot easier than if you're having to respond to a fall or injury afterwards. And of course, safety equals trust. The more we create a safe environment for the residents, the more they trust us, the more they want to continue to come back. So let's talk a little bit more about falls. Falls are the leading cause of accidental death in older adults. Something as simple as a trip and a fall can lead to a head injury. It could lead to a broken bone that might require a surgery. And often a fall is either the first indicator, the first thing that happens where an older adult really spirals downward and needs more care. Most falls occur when people are transitioning. So they're moving from standing to sitting or turning, especially think about during a fitness class. I know Damien's very careful about stepping backwards or doing things like a grapevine move. Anything where people might be able to trip and fall, that's where these occur. Exercise and movement are there to reduce the risk. We want people to get stronger. We want them to have more flexibility, but the very act of doing these exercises could also increase falls. So we want to be sure that we're improving and reducing the risk versus adding to it. We see this one over and over again, and I don't even know how to begin. We encourage people all the time, but pride is a real risk factor in this population. Many older adults won't tell you that they feel unsteady. We have run into a lot of clients recently who have called us and said, oh, the class is too hard or it's working me too hard, but they've never spoken up in class. They are not saying it to their instructors, and they're continuing to push themselves when it's more than they can handle. So be sure that you're really encouraging people to interact, to ask you questions, give them opportunities. What was particularly hard today? What did you like today? Try to adapt. Of course, we want to challenge people. I get that. We want them to do better. But we also want them to feel really comfortable saying, that makes me dizzy, that makes me feel unsteady, that really hurts my hip, whatever the thing is. So we really want to do that. And then be aware that fatigue really increases in the last 10 minutes of class. So that is a time period that you want to be very careful about making sure we cool down properly, make sure that people have been drinking water throughout the class, and really incorporate rest breaks every, 10 minutes or so when we're talking about older adults and fitness programming. Now, falls are not just an issue with fitness in general. So these are some things that you can think about as you're working, whether that's presentations, art classes, whatever you're teaching out there, these are some key things that are really important. The first thing is making sure you have clear walkways. If you are doing a presentation and you have to use a projector instead of a television, you want to be sure that those cords are really out of the way. We want the chairs to be stable and evenly spaced. You frequently find people navigating with walkers in between really cluttered scenarios to be sure that there's plenty of room. If you've got your bag or cords or clutter, be sure that is up off the floor and nowhere someone could trip on it. Adequate lighting, be sure all the lights are turned on in the room. It's not always within our control, but open the blinds if you can, get as much light in the room as you can. And then of course, water available for fitness classes in particular, but it doesn't hurt to always have that if you can. Now, here are just some safe movement principles for fitness. We always want to encourage seated options, one movement at a time. Try not to make it complicated, to explain what you want done and then add on the next one. Very slow transitions, clear verbal cueing, and no sudden direction changes. I know that our staff are really incredibly well trained and have worked with this population before, but I think these are really, really important reminders and that we should all circle back to them from time to time in order to ensure that we have safety for the people that we serve. I mentioned this a little earlier, heat and hydration awareness is incredibly important. We want to encourage water breaks. Watch for flushed skin, sweating, and confusion that could be a sign of a heat stroke. And modify the intensity before being asked. If you see somebody that's struggling, reach out and say, hey, here's an adaptation for you. The older adults will underreport discomfort. They don't want their peers to know that they are struggling. They will fight through, try to be tough as nails. So please, be sure that you're being proactive about watching these individuals. For Aquafit, we actually have a heat policy. We will send that out again, and we send it out every year around the time the Aquafit begins, and it will give you clear guidance on temperatures. If temperatures are over a certain threshold, we do require that the classes be moved inside and a general fitness class done rather than an Aquafit class. So we want to not only prevent heat illnesses from our clients, but from you as well. We don't want you out overexerting yourself in this heat. Some red flags you might see during class, and this could be any type of class. Dizziness, shortness of breath, chest pain, pale or clammy skin, of course, confusion, and shaking or weakness. The beauty of what we do is there are usually staff available in the building while we're there. There are a few classes that we do in the evening or the weekend where you may not have as many staff, but there should normally be someone that you can run to in case there is an issue. Of course, in an assisted living or in a nursing or skilled setting, you're also going to have nurses available to you. So be sure that if you see any of these symptoms that you do let somebody on staff know. If you do have a fall, we want to set some really clear guidelines around this. And I will start by saying that I have had a 30-year back injury from a resident that fell when I was in my 20s. And I tried to help them off the floor and I damaged my spine because I was not a caregiver and I was not trained to do that properly. I don't want that for you. So very important things to remember. First and foremost, if somebody falls, please immediately let the staff know. Or have one of the residents in your session go and let somebody else. Never physically lift a resident. If you need to help position them, if you need to elevate their head, if you need to help them, or if you need to encourage them to sit up, that is fine. But do not physically lift somebody off the floor. You could not only re-injure them or injure them more, but you could hurt yourself as well. If someone is, dizzy and kind of, looking like they're unwell, particularly in our outdoor classes, encourage them to move to a cooler area if they're outdoors and be sure to get them some water. Do not rush your transitions, do not push through pain, and do not ignore imbalance. If somebody is stumbling around, take some time and really encourage them to sit down. A stumble could very easily be a fall within seconds. So as I mentioned before, most of us are teaching classes during the daytime. It's not, a huge ordeal about leaving after dark. However, we do serve clients in lots of different environments and lots of different areas. So we want you to be safe as well. So on arrival and departure, be sure you're parking in well-lit areas. If you've got, large bags, be sure they're zipped up and that you're not carrying them where it looks like a prospect to somebody. If you're leaving after dark, please notify somebody. Maybe that's a friend or a family member, just letting them know. If you ever feel unsafe in the area that you're in, please do ask for an escort to walk you to your car. Most of our sites are lovely and helpful and will not have an issue with that. And trust your instincts. If something feels off, please notify the site staff and call us as well. Let us know if you're uncomfortable and what's going on. We often don't know the details of the environments that are out there. We try to visit our sites, but we learn a lot from our instructors. So please do let us know if something doesn't feel right or safe about a location. All right, let's talk about infection control and bloodborne pathogens. This is what's called standard precautions. When you're dealing with older adults, you are going to, from time to time, come across body fluids. That might be blood, might be urine, might be saliva, might be somebody coughing or sneezing. We want to be sure that you are safe in every way and that they are safe as well. So, few reminders. These are pretty common sense, but important to think about. Wash your hands really well before and after each class. Make sure that you're not bringing anything in and you're not taking anything out with you germ-wise. Carry hand sanitizer, though a lot of these sites will have, especially assisted living or skilled nursing, will have sanitizers on the walls or at the front desk. If you have cuts or wounds on your arms or your hands, wherever, be sure that those are covered well ahead of time. We don't want you to be exposed to any germs, and again, don't want to spread any either. Avoid touching your face, eyes, and mouth during class. If you're using equipment, that might be weights, it might be bands, it might be paintbrushes or tables. Try to sanitize those surfaces as much as possible. A little bit of hand sanitizer on a paper towel goes a long way. And just maintain personal space and respect for people. Back when COVID was more predominant, we talked a lot about keeping a 6-foot distance, keeping that personal space, particularly during flu season, COVID season, could be the difference between you getting ill or someone else getting ill. If for some reason you are exposed to blood or bodily fluids, again, this could be from someone falling. We could have an incontinent episode during class. There's all kinds of things that might go wrong. Alert the staff immediately. Let them know that something's going on. Please do not touch fluids directly. Again, try to get help if you can. Secure the area so that there's no slip or trip hazard. Ask residents to step aside, figure out, a way just to keep the area secure. And then once the incident is handled, please do ask if there's anything you need to do on site. Sometimes if you've witnessed the fall, injury, exposure, they may ask you to fill out an incident report. Please do that if you are asked. And then also report back to us. We have our own incident report process, and we would like to know just so that we can, again, support you in whatever may have occurred. We take flu, COVID, norovirus, all of that incredibly seriously. Older adults were at greatest risk during the pandemic, and they continue to be at risk. They always have been at greater risk with flu exposure. Many of our sites shut their doors or let us know if there are high rates of flu or COVID in the building, and we do try to let you know about that. But for your own safety, as well as our clients, please remember these important things. If you are sick, stay home. Call us. We will figure it out. Particularly if you are coughing, sneezing, running fever. We want to know about that. We don't want you taking that in the building. If you are in a building that is currently masking, please do respect those masking policies. We all have our own thoughts around whether masks work or not, but by law, a lot of these sites have to mask due to, Texas, Arizona, New Mexico, whatever rules. So be sure that you are following whatever masking policies that the staff there requests for you. Encourage spacing. If you know that there is flu going around, you might want to space your chairs out a little bit further. As I mentioned, we will let you know if there's a problem in the building. That will give you an opportunity to decide whether you feel like it's safe or not to go into a location. In general, if they tell us that there is flu or COVID going around, we go ahead and cancel classes just for mutual safety. Wipe any shared equipment, as I mentioned, and wash your hands, wash your hands, wash your hands, wash your hands, wash your hands. That is one of the biggest and most important things that you can do. So emergencies do happen. Not everyone is going to have one, but I'm sure you've all had episodes before in the past. I know that Damien himself many years ago had to perform CPR. We're working with an older population, things can happen. So these are your roles in an emergency. The first thing is we need you to stay calm. Not always easy, but please do stay calm. Do not diagnose. Do not try to figure out what's going on. Call for staff. Get them there right away if there is an emergency with a client. If you need to call 911, please do. We have no problem with that. Hopefully there are staff on site and they can do that and handle it. But if not, if you think that 911 is needed, we would rather you be safe than sorry. And stay with the resident or have somebody stay with the resident. If you do need to run and get a staff member, please be sure that there is someone else that can stay with that person and make sure that they are relatively stable. I mentioned some signs earlier of kind of overheating and tiring. These are some additional things that you should look for. A stroke, of course, you might see face droop, arm weakness, speech trouble. A heart attack may present as chest pressure, jaw pain, or nausea. Fainting, seizures, serious falls, and just that onset of confusion. Somebody who's all of a sudden disoriented who was not before. These may be signs of a medical emergency. And as I mentioned before, after an incident, ensure you have reported to the staff on site. Be sure and contact us so we can know what's going on and document. And please do protect resident privacy. You are, while you're in the building, exposed to information about different things related to residents' care, related to their families. Be sure that you're protecting that privacy. It is a confidential situation. It does not need to be shared with other residents. It does not need to be shared with family members. It does not need to be shared with your best friend. These are private things that happen in private people's lives, and we want to be sure we're respecting that confidentiality. From time to time, you may, again, witness an incident of some kind. It is normal for you to feel shaken after an incident. If someone is hurt, if someone is scared, if somebody injures themselves, it's totally normal for you to feel anxious, nervous, or even guilty, even if it's not your fault. Please do let us know how you're feeling. We don't want you to push through. We don't want you to feel awful and anxious about going to that next class. Let us help you get the rest you need, support you through it, debrief whatever you need to talk about. We genuinely care about the experience. Years ago, I witnessed an employee collapse on the floor. This was with another organization, collapse on the floor at work, and I had to call 911 and I had to try to, help her. She was having a seizure and I was fine in the moment. I thought I was fine in the moment. And about an hour after the incident, I was shaky. and I was upset and I was hyperventilating. Sometimes that stuff comes later. So please do reach out. We know what that feels like, know what that means, and let us help you through that situation. We go into a lot of sites that have people with Alzheimer's or dementia. And from time to time, people with dementia can become upset, agitated, confused in a way that can cause anger or delusions. These are just some tips. We've done dementia training before. We'll do it again in the future, but these are some things that can really just help in that moment. The first thing is to never argue with delusions. If someone says they're going home, if someone says that Elvis Presley is standing in the corner, whatever that thing is, don't argue with them. Say, oh my goodness, what is that like? Or if they're talking about home, say, tell me about your home. Try to use calm redirection to get them back into the program, and just don't argue. It's never worth arguing with somebody. We want to validate what their emotions are saying. So if someone wants to go home, maybe they're feeling insecure or nervous. Maybe they're hungry. Could be that simple. Where's food? Food's at home. Now I need to go home. And we want to avoid embarrassing them. We want to not point out their memory loss in front of them or in front of a group. So just go with the flow. It's called validation, and just follow along. Live in their reality for just that moment. If that person becomes more agitated or begins to escalate, there are a few things that you can do to kind of bring that back down. The first is to lower your voice. We want to mirror the kind of behavior that we hope to see. So staying as calm as possible, making very slow movements. Do not touch a person with dementia who is agitated. Touch can be a very fearful thing, so be sure not to touch them. Step back just a little bit, reduce the stimulation, turn down the volume, whatever you need to do. Ask staff for support, and it's better to get that early. So if you see that somebody's starting to escalate, go ahead and get somebody and get their support. And then if safety is an issue for you, please back up, get a little bit of distance from the person. People with dementia who are agitated can lash out. It's not all the time. It's not everybody. But if you were trying to protect yourself and you were highly confused, you might swing at somebody. We don't want you to get injured, but we also want you to be very well trained in how to de-escalate that situation. So lower the voice, slow the movements, back up a little bit, and ask staff for support. This is just a quick note. This is in the employee handbook, but in terms of gifts and relationships, please do not accept gifts from residents, except maybe, small handmade items. Be sure that you have no financial involvement. So nobody giving you money to run to the store, nobody asking you to deposit a check. You need to maintain a professional role with these individuals. We're there, again, to engage, to entertain, and to connect. Accepting, money, tips, all of that is actually not part of who we are. And be sure that you're maintaining that professional role. My background, for those of you who don't know, is social work and long-term care, and I have been involved in this space for a very, very long time. And there are a few things that are important to keep an eye out for. We're going to hope beyond hope that the care that people are receiving in these locations is as good as it can be. But we also know that that is not always the truth. And one of the sites that we recently, that we worked in, actually had to close its doors because of allegations of abuse and neglect. That's heartbreaking and terrifying and sad. And we want to be sure that if you notice physical abuse, emotional and psychological abuse, or neglect, that we are doing the right thing as an organization. So if you witness or see any of these types of things, unexplained bruises, recurring injuries, somebody who is fearful or who hasn't had their incontinence pad changed in, exceeding amounts of time. There are a couple things that you can do. Obviously, if somebody just needs to be changed, you might want to notify staff about that. But if you're seeing ongoing recurring issues, please reach out to us and let us know what's going on. We will talk through it with you. We will determine whether it's something that needs to be reported to the site or if it's something that needs to be reported further. You are also welcome to report, and you'll see, signs in the building that that you can report to the state. Again, we do have a background in this kind of work, and so if you'd like to reach out first and let's talk it through, we can talk about how to do a report to Adult Protective Services or one of the certification or licensing organizations. If you suspect abuse or neglect, please do report it immediately. If you witness a nurse's aide or a staff member who is abusive to a resident while you're on site, please do notify that site staff immediately and then also report it to us. If we don't think that the site will be responsive, then again, we can escalate to Adult Protective Services or other licensing agencies as we need. You don't need to have proof. You just need to have suspicion. And we're not there to be spies by any sense of the imagination. But if you do see something that is concerning, we want to be part of that solution. So here are a few professional boundaries that are important to be thinking about as you move forward. What healthy boundaries look like. So they are friendly, not personal. There's a difference in being warm and conversational without, getting really in depth with somebody's life. Supportive, not dependent. They don't need to be dependent on you. We are there for one thing, which is to provide a fabulous engagement opportunity. Encouraging, not rescuing. Folks have bigger lives, and you are not social workers, you are not nurses, you don't need to rescue. And they should be professional, not private. Let me say that we know that a number of our staff have developed friendships with people on site. It's a very sticky situation, and we want you to be very, very careful about that. We prefer that you don't share your personal phone number or home address. However, again, some of you may have developed friendships or relationships. Just be sure that you're able to keep the professional piece of you teaching or facilitating class separate from the personal. You don't want to be talking about other residents. You don't want to get involved in apartment gossip. There's all those types of things. So really think about what those boundaries are. Never ever provide medical advice. That can be difficult if you're a well-trained fitness instructor, or you have information around supplements or new medications. Please do not provide medical advice. Always encourage them to talk to their doctors first. Never transport residents. We are not insured for that. You are not insured for that. And there should be no reason for that. So do not transport residents. Do not get involved with family disputes. As I mentioned, do not discuss other residents. And then just a couple things that are really important business-wise. Don't share information about cancellations or schedule changes unless specifically asked to do so. So many times on the back end, there are other items and things that are going on that you may not be aware of. And we want to be sure that we handle that through our scheduling system. We know ins and outs that you don't know, so just don't get caught up in those conversations. Always say, I'm going to pass that on to the scheduling team, or I'm going to talk to my manager. And then taking or posting photos without permission. We love to get photos, but we do not have photo releases on most residents. So if you do take photos, please do not post them on your social media account unless you have, maybe it's just the back of people's heads, or maybe it's just the craft you made. If you would like to use the photo or like us to use the photo because it's a good photo, please send it to us first and then allow us to make sure we can get the proper permissions. This is just a little bit more about the social relationships outside of class. We want you to be real humans. We want you to make, relationships. And so if you do have a friendship within, the residents that live there, do not discuss internal site decisions. Do not share complaints about the site. Don't position yourself as an advocate against management. That's going to cause us all kinds of problems. And do not use personal relationships to negotiate program changes. We are supportive and we will, continue to not say that you can't have friendships. But if we do begin to have problems, then we'll have to be looking at policies around that. So please just be very, very careful about, gossiping about residents, gossiping about apartment staff, gossiping about aging is cool, whatever that thing is, it will come back and bite you. It always does. So just be very, very careful around that if you have social relationships with residents. I'm going to skip this boundary scenarios right now. In our training upcoming, we will do this more in depth. But some of these things, just think about a resident asks you to walk them back to their apartment. That could be a safety issue. A resident wants medical advice after class. We should not be giving medical advice. A family member asks you about another resident. You should not be disclosing any information about residents to anyone. And a resident insists they are fine but appear unsafe. That might be the time when you ask them to sit down or encourage them to rest. And finally, we just want you to know that you are not alone in this. You are not expected to solve all the problems. We want you to be safe, and we want the residents to be safe, and we want the company to be safe, and we want everybody to have a great time, including you. So you're not alone. You don't have to solve all the problems. Please reach out. Questions, concerns, things that are bothering you, little niggly things that are kind of driving you crazy that you think might become a bigger problem. We want you to report concerns, and you are expected to report concerns. So please let us know how we can help you through your day-to-day and stay as safe as possible. All right. Thank you, everybody. If you have any questions, please do reach out to me, Amy at agingiscool.com, and I will be more than happy to answer those.